Hello, everyone, and welcome to another CE presented by the National Hispanic Pharmacists Association. We're so happy to have you, and for those who have come back to view another one of our CEs, we thank you for being another visitor as well as being a member of NHPA. We have a fantastic presentation for you today. I won't get into the individuals who are speaking today because I'll leave that for our moderator, Dr. Mayra Boitel. So if we could go to the next slide, please. What I would like to do is to welcome you to this presentation. My name is Lisa Marie Serrano. I am the Programs Committee Chair for the National Hispanic Pharmacists Association, as well as sitting on the board of directors for it. Just some housekeeping items to remind you is to keep your microphones muted at all times. Please make sure to type in any questions into the chat box. We will have an open discussion at the very end. Some time for you to give us some questions and answers. We will also go back and answer those questions that are in the chat box. So please make sure to put in your questions as we go along. We will be recording this, and the slides and instructions to receive CE credits will be sent out and posted on our website next week. So thank you again so much for being with us today. Next slide, please. Just a quick reminder of who we are. As the National Hispanic Pharmacists Association, our mission is to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaboration with public and private sector partners. Our vision is to be the lead pharmacy organization for improving the health of Hispanic populations in the United States. For those of you who are not members of NHPA, but who are joining us today, and you would like to get more information about our organization or to become a member, please visit us at nhmafoundation.org/NHPA. We'll have more to come at the very end, but for now, please next slide. I will pass it on to our moderator, and she will be presenting our presentation today along with our speakers. Mayra.
Hey. Thank you, Lisa. Good evening, everyone. First of all, I also like to extend a warm welcome to all of our guests, and I want to personally thank our distinguished speakers for this evening, Dr. Manzor and Dr. Lopez. My name is Mayra Boitel. I will be the moderator for this evening. I am also a member of the board of directors for NHPA. So we do have an incredible program for you this evening, and without further ado, I'd like to present Dr. Manzor, who will start our presentation this evening.
Hello, and thank you. Next slide. Today, I'm going to be talking to you about mental health management and addressing stigma among Latinx adults. Next slide, please. I have nothing to disclose. Next slide, please. Today, I'm going to describe stigma, stigmatizing beliefs, and the effects on Latinx adults. And I'll also go over some practical ways to reduce stigma. Next slide, please. I'd first like to go over some general information about mental illness among Latinx adults. About 50% of Latinx adults report a mental illness in the past year, and this is actually a similar rate as non-Latinx white adults. And however, compared with that population, Latinx adults are 50% less likely to seek and receive treatment. We do know that the suicide rate among the Latinx population is lower relative to a non-Latinx white population, but we're seeing that that gap is narrowing, and we're also seeing that in higher rates in certain Latinx groups. So that's something that we're really paying attention to, because that's an indicator, obviously, of severity of depression or of mental illness. And the World Health Organization reports that mental illness stigma is the most substantial obstacle to seeking treatment for mental illness. Next slide, please. Stigma is a negative attitude or discrimination against someone because of a distinguishing characteristic. And it can subject that person to prejudice and discrimination from others. There are several types of stigma I'd like to talk about just a couple today that are more in line with what we'll be talking about later on in the presentation. So the self-stigma is an internalized public stigma, which public stigma is when society has a negative stereotype or prejudice about someone or a population. And so self-stigma is internalizing that public stigma, and it harms a person's self-esteem and self-efficacy. Label avoidance is where someone will, because of this stigma, will avoid being labeled with that characteristic. And so they'll avoid treatment and they'll avoid whatever they can do so that they're not, don't have that label. And then the last stigma I want to go over is health practitioner, where that person allows stereotypes and prejudices to negatively affect patient care. Next slide, please. These are some stereotypes that I imagine most people are familiar with, or you've heard some of them. And I put them here for everybody's information, and because we probably know what these are. My general recommendation is to avoid using stereotypes and focus on behaviors and ways that things that people do that will actually are contrary to being successful at either getting a diagnosis for mental illness or getting treatment. And so I try to focus on the behavior, which will help facilitate change. Next slide, please. And so some of the characteristics that the Latinx culture may have that are, as I've listed here, are positive characteristics are that they are, that they're happy people, that they're funny, they're always laughing, carefree, they're very polite and pleasant, and some characteristics having to do more so being flirtatious or so a very positive demeanor and characteristic, and also this very much stereotypes of being resilient or hardworking, strong, very altruistic, selfless, and so these are great characteristics, yes. But what happens is that they can be inconsistent with how somebody feels when they have mental illness. And so there can be a conflict as a result in an individual when they don't feel that they are representing what they're supposed to be, like they're supposed to be this way. And so they feel that there is a disconnect. Stereotype threat is where somebody acts out this stereotype and it becomes what they feel that they have to do. So next slide, please. So then, and so the reason I mentioned those things, stereotypes and stigma, is because, or stereotypes and stereotype threat, is because these are things that eventually will lead to stigma. And so if somebody can be familiar with what those are, then that can help them understand what stigma is and then help address stigma. Also, what actually perpetuates stigma and related to mental health. And so a lot of it has to do with somebody saying, that that these symptoms that the person has are trivial, they're going to go away on their own, they're not real. And there's lots of phrases that people will use that they just need to, persevere. They just need to do their part. There's no need to seek treatment, those types of things. And then also, expressions that are that perpetuate that stigma and then make somebody, they could either hear somebody say them or they say them to themselves, and they limit what any sort of like treatment seeking or even like support that they might give themselves or give others if they see those. Also, the belief that mental illness is associated with violent behavior. Those are some things also that people may believe are to be true, but aren't necessarily true. And then a lack of communication. So somebody very much wanting to maintain their privacy because they have shame or embarrassment. Next slide, please. Now I just list these here because what we know is that when somebody already has stigma that might be related to having mental illness, then if they have other characteristics that maybe in society and in the Latinx culture may be also viewed as being different or have stigma. And so I've listed some of them here, and it could be even in the American culture. So perhaps, their immigration status or that they're an immigrant. that English isn't their first language, that they have an accent, or they don't have, they're not proficient in speaking English, or their socioeconomic status. These are all things that are additional sources of stigma and can even just make stigma worse and add on to and perpetuate even further some of those, lack of treatment seeking behaviors. Next slide, please. Okay, so these are some of the consequences of stigma. So stigma is powerful, and it can be very disarming to someone. And so I wanted to list the consequences of stigma. I actually have 2 slides because there are quite, lots of consequences, and they can be very serious. And I don't know that we as healthcare providers necessarily consider how powerful stigma can be. So I wanted to just touch on, the first one, which is that the first step is that an individual can just feel shame and self-doubt. And so that's where it can start. And that eventually that it can get to be more substantial for that person and lead to, reduced likelihood of seeking treatment. It can lead that person to isolate themselves or avoid others because of embarrassment. Next slide, please. And then also eventually sometimes people can become victims of harassment or violence or bullying because of the stigma. And we know that mental illness is the leading cause of disability. And so this stigma can perpetuate that feeling of being unable to, manage this mental health illness or mental illness, and then it becomes sort of a vicious cycle. And then people may feel that they're losing the support of their family because they are, they feel that their family is the source of stigma, and they avoid interacting with them. And then, as listed here, unfortunately, stigma can lead to a poor quality of life. And then we know that it's associated with poor outcomes for mental illness. Next slide, please. So, so some of the things that you may hear that could be an indicator that an individual is feeling stigma related to their mental health is when they say things, and this isn't all inclusive, it could be other reasons. It could be their history with medication or treatment. But if they're saying things like that, treatment isn't needed, it's not necessary, when they clearly have maybe, other indicators that that their mental illness is more severe. So they're basically disparaging of treatment or saying that it's not needed. And some things also that can, because of stigma, it can reduce the effectiveness of treatments that we find very effective in managing mental illness, such as cognitive behavioral therapy. It will keep people from sharing information because they feel shame, or they feel like they should not have those thoughts or feelings. And then with treatment, they may have think that side effects are more serious than they actually are, or they might have concerns about, such as with antidepressants, that they will have a dependence or an addiction to them. And so then that will be a reason that they may not want to try it. And it's perhaps could be more rooted in a fear that they don't want to be associated with having that mental illness or having to take something to treat it. Next slide, please. And then, a perpetuation of fears and myths. And so they may share some of those with you about, treatment in general or side effects. They may share with you some of the things family members have said to them that are disparaging of seeking treatment. And they may share some misinformation that perhaps they read on the internet or somebody shared with them about whether or not medication or other types of therapy are helpful. And so, also, some things to think about that are related to stigma in treatment is that, there could be a history of where they were with another healthcare provider or in some other setting where they were receiving treatment, and they felt that the stigma there, stigma was not addressed or it was perpetuated. And so then there could be this mistrust. And in general, we do know that underrepresented minorities do have less trust of healthcare providers, especially if there's a lack of congruence and, like a discordance in language or in culture or representation with that healthcare provider. So next slide, please. So how can we, as individuals or our patients, how can they reduce stigma? And so what I recommend is sharing with that person about, about mental illness, that it is common and that it doesn't have to be lifelong, that it is manageable for the majority of people, that there are treatments that will help reduce symptoms, that there are ways that will empower someone to help manage it, such as mindfulness or self-reflection, and encouraging individuals to do that, because that is actually been shown to just have a better quality of life if people do these types of activities. And so I always am recommending that to patients, and I practice it myself. And then just encouraging, like, getting factual information from reputable scientific sources about treatment, about courses of therapy, how long people should be on therapy, and what that looks like. And then finally, what I would recommend, at least based on this slide, is familiarity. And what that is having people interact with others that have mental illness. And so what studies have shown is that when somebody has a close relationship with somebody who has mental illness, that they are more likely to have less stigma to others that have mental illness, and they're and that they're more understanding of that person, and more likely to be supportive of people that have that characteristic or mental illness. Next slide, please. And so as a healthcare professional, there are so many things that we can do, and I'm just going to touch on a few things because there is a lot of overlap, especially at the beginning, with what we can do as individuals. And really what I would, from the slide, I really want us to take away is that is having a self-reflection. So even though, we're healthcare providers and we have this great source of knowledge, I believe, as somebody who believes in patient-centered care, is that the patient really knows themselves the best, and that we are partners in their care. And so, and that being said, that that I could have beliefs that are implicit biases that may be resulting in stigma. And so I always try to approach it from that perspective and be very respectful of how somebody is presenting and the things that they're sharing with me. And and doing my best and being mindful that my internal biases are not impacting negatively in any way that interaction with my patients. And then also just encouraging the idea and promoting the idea that physical health and mental health are equally important, and that you can't really have one without the other. Next slide, please. Okay. Right. So, and so then, in addition, I would say is that, being careful of the language we use, avoiding stereotypes, standing up, for people who are being stigmatized, and then, listening to that, that individual and showing compassion. I found that those have been really very, very helpful in helping address stigma. And so the literature supports that as well. Next slide, please. Right. So I wanted to end this presentation with focusing on how mental illness is common in the United States, including among Latinx adults and Latinx people, our community. And that stigma is common related to mental illness, and that it makes mental illness more difficult to diagnose, and for people to seek treatment, and for them to stay on treatment. Then also, there's lots that we can do as healthcare providers and as individuals to address stigma, to normalize having mental health, and to do things that promote mental health, and that when somebody has mental illness, to address it as we would any other physical disorder, such as hypertension or diabetes, that it's something to be treated. It's an illness. And then always encouraging. I know that as healthcare providers, we really do make the effort to be respectful of our patients and to listen to our patients, but sometimes we're just busy. We've got a high caseload. Lots of things are happening that are distracting us or keeping us from interacting with that patient. But as much as we can, to refocus and center on that patient, to listen, share, respect, and show compassion, and practice mindfulness. I think those are all very helpful. So I really thank you for your attention. And on the next slide, I do have my references. That's actually the last slide. And then this slide, I have some resources that I have found very helpful if you are have a patient or someone who does need help and needs it in Spanish, that these are great sources of those resources. And then on my last slide, I do have some references for you. So I look forward to answering your questions at the end of the presentation. And thank you so much.
Thank you very much, Dr. Manzor. Very insightful information. I know I learned a great deal. We appreciate it. I just want to remind all of our guests, if you have any questions, to please enter them into the chat box. And with that, I'd like to introduce our next speaker, and that would be Dr. Lopez. Dr. Lopez will be doing the second portion of our presentation. Dr. Lopez?
Thank you. And then Marisa, may I share now? Oh, I think you just said yes. So, okay. Thank you. Is it sharing?
It is, Dr. Lopez. It's loading.
Okay,
We'll give it a few minutes.
thank you. Just let me know when you see it.
You're good. Yep.
Thank you. So thank you that was a great presentation. And I think it really dovetails well in following with this next section, where we'll really focus on how do we foster resilience, wellness in Latinx health professionals. So I first want to start with a thank you. And I want to thank certainly NHPA, NHMA, all of the organizers, and all of you, and specifically because you're taking the time to take care of yourself. And that's something that, as we're busy in life and as we're busy in work, we often forget to take care of ourselves. So that's a big focus of the conversation today. No disclosures. And what we'll cover is really thinking about the factors that impact wellness, satisfaction, and burnout, discuss personal and organizational supports towards resilience and well-being, and think about how we can commit to a resilience practice. So let's start. And you have the chat. I think I can see the chat. Does anybody want to jot in something that they might think are some of the factors that impact wellness, satisfaction, burnout? Any thoughts or ideas? I'll open the chat. Anything? Okay, well, I'm sure you all have ideas, so we'll just go on then. Let's see. So a big factor for us over the last now 18 months has really been COVID. And I want to, again, as I bring these topics up, I think we are up here all the time. So I encourage you to feel what it's been like for 18 months. We really have had a period, all of us, a stress of prolonged isolation, separation from loved ones. And, you know, family is important to us. Friendships are important to all of us. So it really has been a major stressor for us as humans. And it's compounded by fear, because certainly we're all very concerned about the stressor of possibly being ill. And many of us have had illness, and many of us have lost loved ones to the illness. So there's social isolation at a time when we most want connection. And as this goes on for even longer, you know, at the beginning of summer, I think so many of us were so hopeful that things were going to be getting back to normal. And now many of us are questioning, what does that even mean? You know, people are talking about how, well, this is our new normal. What, if that's true, what does that really mean to us and how we work together? And I think what that brings us to is this sense of really what's in my power to influence. And, you know, one of the last comments from the prior presentation was about mindfulness. So really thinking about what's really in my power to influence, where can I impact change? And from that thread to begin to build and to begin to build a sense of impact. So stress can manifest in many ways, and we're very good about identifying these in our patients. But how do we identify these in ourselves? You know, if we take our own vital signs, so to speak, for many of us, this current surge and some of the previous surges have really been exercises in post-traumatic stress. In general, we know that clinicians are not very good about eating well, are prone to substance use or increased alcohol use. And I did intentionally put on this slide post-traumatic stress twice, because it is often where we don't process, so we relive the experience. So important for us to think about, take our own pulse, take our own assessment of where we are. So COVID has impacted all of us. Stress and how we react to stress can impact all of us. But COVID has particularly impacted our populations. And just some examples, I had moved to Jefferson in Philadelphia from the University of Utah, where the first surge, Latinos, 14% of the population and 42% of the confirmed COVID diagnoses. So again, really significant impact on our populations. In California, Latinos, 43% of the population under 50, adult population under 50, but 70% of the COVID-related deaths. So we could go on in this litany of facts, but impacted our population. And if you look at the deaths, again, it's so important for us to look at the data, to look at the difference, to see who's impacted more or less, and to try to understand why and how we could support each other and improve those outcomes. So overall, that Indigenous, Black, and Latino Americans have been nearly 3 times more likely to die of COVID than white non-Latinos in 2020. Significant facts that have impacted us just living in the world, and certainly as health professionals, because we've seen it, we've been there to see it. The impacts that COVID has had that so many have written about, that it's not just the biological impact of the illness, but also the economic impact. And again, that's something we've all felt, the economic impact of on all of our lives. But as we are essential workers, as healthcare professionals, really hitting us more so. And these are some data in essential workers coming from New York that's showing the impact really disproportionately impacting those of different race, ethnicity. But what about health professionals? Now, again, a lot has been written about burnout. So it's really this coming together of these different areas, the depersonalization, the emotional exhaustion, the sense at times of a loss of meaning or purpose, and certainly a loss of community, that these are associated with health professional stress, that these are associated with symptoms that we've talked about, poor sleep, poor difficulty in concentration, poor eating, and lack of de-stressing. So as health professionals being more vulnerable. And this is if we have these symptoms once a week. Once a week. Now, for many of you, maybe as you were listening, you're like, oh yeah, I mean, maybe a couple times a week, but the definition being the threshold of once a week. The World Health Organization in ICD-11 actually came up with a definition of burnout. So it's so prevalent, and it's so prevalent worldwide, this chronic workplace stress, that it now has its own ICD-11 definition. And as was touched on in the first talk, the challenges of clinical work, the competing demands, the time constraints, all of these can really add to this sense of burnout for health professionals. Now, some words on pharmacist specific, and this is an area you may know that most of the data on health professionals has focused on physicians. So this is an area of a lot of interest research-wise. And so if you're interested in this, this is an area that would be ripe for research. Sources of stress, too many non-clinical duties. And so many of these are similar across the board for physicians, for nurses, for multiple health professionals. Uncertainty regarding all of these stressors in healthcare, time constraints, performance metrics, lack of control. And that's partly why identifying your focus, your locus of control, can be very impactful in fighting these stressors. It appears from the data that those that are at greatest risk are those, whether hospital pharmacists or community pharmacists, are those that are more isolated and those that are working more hours. Pharmacists do residencies, and residencies really promote the conditions for burnout. And again, because it's a time of isolation, this sense of not enough time to do all the work that needs to get done, the deadline of pressures, the stressors financially, and the long working hours. So a warning sign, you know, as we talked in the earlier conversation about the stressors for young people, important for us to think about how can we protect in some ways, but also really address the needs of those that are coming up in our professions. Looking at coping skills. These are a study that looked at pharmacy residents and coping skills and found some of the ways that people coped, spending time with family and friends, staying optimistic, engaging in enjoyable activities. But these are the sort of coping skills that have been very limited because of the COVID pandemic. And the transition from the PGY1 to the PGY2 year, similar feelings about stress, burnout, and depression. But with the burnout, there can come this sense of hostility, this sense of anger that can arise. So again, important as we take our own pulse, our own sense of how we are coping with stress. These are data from women physicians because, as in many other areas, we are now thinking more interlinking. So what are the stressors for health professionals? What are the stressors for women health professionals? What are the stressors for people of different ethnicities? And where do these intersect? And here, again, I think many of these would be aspects that we are familiar with. This sense of imposter syndrome, stereotype perception, this conflict between being a competent health professional and being a nurturer or a caretaker, the gendered expectations that we may feel. So as we learn more about how to nurture well-being, how to nurture resilience, important for us to think that we're different. And where do these factors fit in for each of us? So another area very important for research. So how do we look at personal and organizational support for resilience and well-being? So we've talked about the stressors. We've talked about the disruptors during this COVID-19 pandemic and this sense of isolation, which we've all experienced. You know, I spent the day taking care of patients today, both in the inpatient and the outpatient setting, and wearing all the garb. That by itself is this sense of separation from our patients. But where to start? And again, if we start with where our locus of control is, where we are, be kind to yourself. Value what you are doing. Reconnect with that sense of value, that sense of purpose. And again, I'm a big fan of mindfulness, meditation, just taking that time. Even when I talk to the students, I say, that second when you touch the doorknob to enter the room or when you knock. That can be a clue to breathe, relax, and be present. We can then, a second locus could be support each other, build community. And although this is virtual, I think that this is part of what this is. We're building community, we are supporting each other. Mental health support. So important to reduce the stigma around mental health in so many ways to do that. And then fostering a culture of wellness in our workplace. Compassionate leadership being so important. So think about how the pandemic has affected you, where you are if you take your mental health or well-being pulse, how it's affected your family, your loved ones. And then in the same way that you would with a patient, where am I and where would I like to be? What can I do? I give gratitude journals to my patients, ask them to do that first thing in the morning, last thing in the evening. Eat well, sleep well, and find joy. Joy and laughter can be so nurturing. And as we think about our bodies, we live in our bodies for our entire lives. Exercise our bodies, and part of that is exercising our brain. So find ways to have joy and play in your life. Identify like-minded people. And again, I think even in the virtual space, this is very effective. What you can control and what you can control together. This is not simply about individual solutions, but partners in your workspace to help create more compassionate, I loved your word, compassionate workspaces. So we can create a culture of well-being that really destigmatizes mental health, encourages, supports people to seek help, where we prioritize our relationships. We talk about the doctor-patient relationship. There is the nurses relationship, the pharmacist relationship. So really, these relationships are so important to what we do as healers, but also so important of how we interact with each other. So what would this look like, And again, envision it in your own spaces. It might mean on-site childcare. It might mean just that we carry each other's beeper so somebody can go for a walk. But how can we protect each other and nurture each other? Bring together a group. I'll give you some resources and you can put these into actions. Develop teams, develop an action plan, and then assess it. Did it work? And celebrate your outcomes. Think about how you would measure. Think about this as a metric for quality. Some resources for you from the AMA, the Mini-Z is an assessment tool, and there are step-by-step programs that they can outline for you so you can develop a culture of well-being. From the Pharmacy Association, the American Society of Health System Pharmacists has resources readily available for you. So together, as multiple disciplines, we can come together to improve. And ultimately, let's find our commitment for resilience practice at the personal level and at the organizational level. I leave you with really, I saw this and as I was thinking about it, and I just thought this was just the essence of what we're talking about. When you're on the plane, it says, put your oxygen mask on first. And so that's what we need to do to care for each other. So think about your commitments and resources available. Thank you very much. And thanks for the opportunity to be with you today.
Thank you very much, Dr. Lopez. That was an incredible presentation. Really alarming facts about how COVID has really impacted the Latinx community. And I have to tell you, I really love your statement about joy and laughter, how nourishing it is. I totally agree with you. And love the analogy about the oxygen mask, right? We got to take care of ourselves so we can take care of others. So with that, we have our Q&A, and I want to encourage all our participants, if you can please enter any questions that you may have into the chat box. I can read them out for our two speakers for this evening. Okay. So it appears that at this point, we do not have any questions. Both of our speakers did a wonderful job, answered all our questions. I want to thank you both. Thank you again for joining our presentation this evening. We appreciate all of you, and we also look forward. Lisa's going to share when is our next presentation. Lisa?
Sounds great. Thank you so much to both of our speakers and Mayra for leading us through this presentation. We really appreciate your time. We appreciate the participants' time for spending the evening or afternoon with us, depending on where you are coming to us from. But we want you to connect with us even more, not just on this CE presentation, but even beyond that. So please reach out to us in any which way you can, either if that's through our website or through one of our social media platforms. We'd be happy to connect with you directly to give you more information about NHPA or where we are headed as far as with either our CE presentations or our webinars for our students. If I could have the next slide. Many of these presentations have already taken place, but I do want to highlight a few that are coming up for our Pharmacist CE webinars. We have one coming up in November. It is the impact and management of diabetes. We are starting to plan our 2022 series. So what I would encourage you to do is connect with us either through our social media platforms or directly to either one of the board of directors or in any which way you can to give us ideas on what you would like to learn about. In addition, we also have student pharmacist webinars, which are occurring. We have one coming up in September, which is how to make the most out of pharmacy school. This one is always a great one to talk about with students because it's really kind of fluid right now, especially with the changing dynamic of COVID and where they're at with schools, if they're going back or not, and if this is all going to be virtual, and really how to make them stand out in this virtual world, especially depending on what their career goals are. In December, we are going to have another one, and the title of that is Have an Application That Stands Out from the Crowd. This one is a really great discussion that we have with the students, and we really show our vulnerable side during this, where we talk about those fears that students have during the application process and help them to really stand out. So again, please visit us at our website, nhmafoundation.org/NHPA. We look forward to hearing from you soon and seeing you on our next CE presentation. Thank you to both of our speakers, Dr. Manzor and Dr. Lopez, and Mayra Boitel for a fantastic leadership throughout this presentation. Have a great evening, everyone.
Thank you.
Thank you.
Good night, everyone.